Good day, everyone. So, we will be presenting our case study entitled Influenza, a Household Case Study. And it is prepared by Ms. Alcayera Altea and yours truly, Garjola Joannelin. So, for the pathophysiology, influenza is commonly known as the flu, and it is a highly contagious respiratory disease which is caused by the influenza virus. And there are three types of the influenza virus that can infect humans: influenza A, B, and C. The difference between these three is that influenza A and B are responsible for the annual regional flu epidemics or the flu season, which is when cases of the influenza rises. On the other hand, influenza C may lead to mild illness but not epidemics or pandemics. So the flu is typically transmitted from person to person via respiratory droplets or in some instances aerosolized particles that are expelled from the respiratory tract of an infected individual. And these droplets can be propelled a few feet into the air when we are talking, coughing, or sneezing. And it can also land in our eyes, nose, or mouths of people nearby or get inhaled into the lungs. Additionally, influenza can be transmitted indirectly, especially when an individual touches a contaminated surface and then prior to washing their hands, they touch their eyes, nose, or mouth. So, after a person contracts the influenza virus, after a person contracts the influenza virus, or once the virus is inhaled, it will enter the lining of the nasopharynx or the bronchial tree, and there it targets the columnar epithelial cells. And the step for this cycle is binding to salicylic acid, entering the cell, replication, and the release from cell. In binding to salicylic acid, the hemagglutinin on the viral surface binds to salicylic acid, coating the cell surface. And this complex triggers the cell to engulf the virus, forming an endosome within the cell. And the viral M2 protein acidifies the endosome, breaking down both the virus and endosome membranes and releasing viral RNA. And when it enters the cell, the viral and RNA enters the cell nucleus and initiates rapidly the viral replication. And in the viral replication, the new particles are packaged within the cell and transported through the cell membrane. And then lastly, it will release from the cell. Um, it when it releases from the cell, the neuraminidase on the surface of new viruses cleaves the molecules of the salicylic acid, allowing release of virus. Then the viral replication initiates the process of cell death, which occurs several hours after release of the virus. And then after the release of the virus from the cell, our immune system launches launches an inflammatory response which results in visible tracheobronchial redness and swelling, as well as mucus discharge, as these cells start to produce more mucus that can help trap and eventually expel the pathogens that we inhaled. And in certain cases, the disease or the flu or influenza can become more severe and spread to nearby areas, leading to complications like sinus or ear infection. And if the virus managed to invade the lower respiratory tract, the patient can potentially develop pneumonia, which is characterized by fluid or pus buildup in the lungs. And in addition, the disease may weaken the our immune system, making the individual more susceptible to contracting a secondary bacterial infection. And patients who are high at risk of developing complications includes children under 5 years of age, adults over 65, and patients who are pregnant or patients who have chronic heart or lung disease. So the clinical manifestation of influenza includes headache, fever, chills, fatigue, and weakness, body aches, runny nose with watery nasal discharge, sore throat, and cough. So our case is CG, a 34-year-old male, presents to the Urgent Care Center with concerns of persistent fever requiring around-the-clock, over-the-counter fever reducers, and cough with nasal congestion. He woke up 3 days prior with moderate muscle aches, which he initially attributed to his workout the day before. And patient's wife, SG, begins oseltamivir prophylaxis, 1 capsule, 75 milligrams daily for 10 days, since, since she will be the primary caretaker for her husband and children during this time. Prophylaxis is recommended in persons 1 year and older by the FDA and 3 months to 1 year by the CDC and American Academy of Pediatrics. And 2 days later, WG, 2.5-year-old male, presents to pediatrician with respiratory symptoms and fever of 101.8 Fahrenheit. Test positive for influenza B, begins oseltamivir within 12 hours of first symptoms, 5 ml, 6 milligrams per ml twice a day for 5 days. And JG, a patient 5-month-old infant secluded from CG and WG until 48 hours. Following fever resolution. Continues to nurse, available data indicate that oseltamivir is poorly excreted in breast milk. So for our SOAP analysis, information gathering, patient demographics of CG, he is 34-year-old, male, economic status, height, and weight is not indicated. For patient WG, age 2.5 years old, male, economic status, weight, and height is not stated. For patient SG, which is the wife of patient CG, age is not indicated. She is female, economic status, height, and weight is not also indicated. Or is not stated in the case. For patient JG, 5-month-old infant, sex, economic status, height, and weight is also not stated. Patient history of CG, patient medical history, review of systems, medication history is not also indicated in the case. However, his social history, he is a father who has a hobby, which is he regularly works out. And allergies, no allergies indicated. For patient WG, social history, interaction with his father who has experiencing and tested positive for influenza B. Allergies, no allergies was indicated. Patient SG, who is the wife of patient CG. Social history, also interaction with her husband who was experiencing and tested positive for influenza B, and no allergies indicated. Patient JG, who is the 5-month-old infant. Social history is interaction also with his father who has experiencing and tested positive for influenza B. For the subjective information or symptoms, so our patient experiences head congestion, fatigue, body aches, respiratory symptoms, sore throat, cough, and fever. And according to the clinical guidelines that we've found entitled Clinical Practice Guidelines by the Infectious Diseases Society of America 2018 update on diagnosis, treatment, chemoprophylaxis, and institutional outbreak management of seasonal influenza. These symptoms is a good indicator of presence of influenza. For the objective informations, patient information, we have CG, a male who is 34-year-old, WG, his son, male, 2.5-year-old, SG, his wife, female, JG, they are 5-month-old infant. For the laboratory test results, for CG lab results, he was tested positive for influenza B. His BP is 134/90, heart rate 93 beats per minute, and respiratory rate 19 breaths per minute. For WG lab results, he is also tested positive for influenza B, and when he is presented to the pediatrician, his temperature is 101.8 Fahrenheit. For the medications, CG is CG's medication includes ashwagandha, 1 capsule a day, and turmeric, 1 capsule a day. For WG, he has given oseltamivir within 12 hours of first symptoms, 5 ml, 6 mg per ml, twice a day for 5 days. For SG, she began taking oseltamivir prophylaxis, 1 capsule, 75 milligrams daily for 10 days. And for JG medication, prophylaxis 3 milligrams once a day for 3 days. And for the succeeding slides, it will be reported by Miss Althea Alquilar.
Okay, so let us now go sa assessment. So, unang nakita namin sa case ay unnecessary drug therapy. Why? Kasi di ba sa patient ay gumamit siya ng ashwagandha and turmeric. Wherein, yung Cleveland Clinic, sinasabi nila na ang ashwagandha is a medicinal herb na nakakapagpaboost ng vitality, it enhances general health, and it lessens inflammation, pain, and anxiety. So based doon, ang ashwagandha is a non-selective medicine that doesn't exactly target our respiratory system. So hindi siya nakakatulong sa pagpapagaling ng influenza. Gaya rin ng ashwagandha, ang turmeric is for people with inflammation, metabolic syndrome, arthritis, hyperlipidemia, anxiety, muscle soreness, and kidney health. So hindi rin siya effective to use for influenza. And there are a lot of studies na hindi naman talaga ito nakakatulong para magamot natin yung influenza because this is a respiratory illness. Next is the adverse drug reaction. So dahil sa undesirable effect ng oseltamivir sa kanya, it caused more pain or mas pinatagal yung sakit ni patient kasi nga hindi naman nag-effect sa kanya. Lastly, din sa additional drug therapy dahil sa untreated condition ni patient. Di ba binigyan siya ng oseltamivir pero hindi ito gumana kay patient o hindi nag-exert ng effect yung drug kay patient. Next is the primary impression. Number 1, oseltamivir had no effect on him. For us, we have here yung delayed ng visit sa doctor. Kasi, for us kasi, it affects the efficacy of the drug. Kaya walang nangyari sa condition niya pagkainom niya. And then next, he used medications such as ashwagandha and turmeric. And lastly, all his vital signs are normal. So, gumamit siya ng medication na hindi naman appropriate doon sa illness niya. Okay, so the clinical guideline that we use in this case is the Clinical Practice Guidelines by the Infectious Diseases Society of America, 2018 Update on Diagnosis, Treatment, Chemoprophylaxis, and Institutional Outbreak Management of Seasonal Influenza. So the list of patient symptoms with treatment goals. So the signs and symptoms, first the head congestion, fatigue, and body aches. The goal of treatment is to relieve the pain. Next is the respiratory symptoms, sore throat, and cough. The goal of treatment is to soothe the irritation in the throat. Last is the fever. The goal of treatment is to normalize the body temperature. Yung mga drugs na ginamit niya dito for the head congestion, fatigue, body aches, and fever is to, yung ibuprofen, yung analgesic na ginamit niya. For the cough, for the sore throat naman, for respiratory symptoms, ang ginamit niya dito is the ashwagandha and the turmeric. Okay, so sa plan naman tayo ngayon. So for non-pharmacologic therapy, there are lifestyle and home remedies that may help to ease the symptoms. So unang-una natin dyan, syempre uminom tayo ng maraming water para ma-prevent yung dehydration and rest to help the immune system fight the infection. Meron din tayong i-add na kumain ng mga masustansyang pagkain gaya ng prutas, gulay, ganyan. So sa prutas, syempre, kailangan tayong kumain ng mga gano'n like pampalakas ng immune system, like yung mga may vitamin C, like orange, ganyan. Syempre sa gulay, alam na natin yon, kailangan tayong kumain ng mga masustansyang pagkain para matulungan natin yung katawan natin na labanan yung infection. Next, for patient WG naman, ito yung anak niya na 2.5 years old na meron pa rin cough kahit na gumaling siya. Si patient kasi na 2.5 years old is gumaling siya sa oseltamivir. Kasi 'di ba, within the 48 hours na nagkaroon ng symptoms yung anak niya is naagapan nila. So napainom nila ng oseltamivir. So gumaling si anak pero meron pa rin siyang cough. So based kasi sa research namin, ang influenza kapag gumaling ka is meron ka pa rin talagang cough. It lasts for at least 2 weeks kahit na magaling ka na. So, kailangan pa rin natin itong pagalingin kahit na wala ka ng influenza. So, we advise using only natural remedies like taking honey and drinking plenty of fluids like water. Same lang din, kailangan din kumain ni anak ng masustansyang pagkain, prutas, ganyan, magpahinga, drink plenty of water. And kasi hindi kasi pwede kay patient na 2.5 years old yung mga OTC drugs. So, we advise na talagang mga home remedies lang yung gamitin natin para kay 2.5 years old. Next is we need to assess and monitor the respiratory status, breath sounds, oxygenation, and temperature. Siyempre, kailangan pa rin natin yung i-monitor yung kanyang paghinga, yung oxygen level niya, yung temperature niya. Next, last is we should always wash hands, cover mouth and nose, and avoid close contacts. Siyempre, alam natin, virus yan. Kailangan palagi tayong malinis para maiwasan natin yung pagkalat niya or maiwasan natin na mahawa tayo. Kailangan natin talagang magugas ng kamay, mag-cover ng mouth. Parang COVID-19 lang din na pandemic, di ba? Ganyan yung ginagawa natin. So, meron tayong quarantine, we always wear face mask, and we always wash our hands. And dito kasi kay patient, hindi niya naman alam na influenza yun. So, hindi siya nag-avoid ng contact dun sa family niya, especially dun sa mga anak niya and sa asawa niya. Kaya nahawa yung anak niya. And also, meron siyang wife na nagpapa-breastfeed dun sa baby nila na anak. So, that is what we need to always remember na kailangan pag may sakit tayo, especially yung mga ganyan, we need to avoid a close contact talaga with other people. Last is the pharmacologic therapy. So we continue taking analgesic drugs. So sa case ni patient, we will advise the patient na i-continue na lang yung pag-take ng ibuprofen, yung analgesic drugs. Kasi kung bibigyan natin siya ng antiviral drugs is used for like that, influenza. So, i-advise lang natin siya na ituloy yung analgesic drugs kasi kung bibigyan natin siya ng antiviral drugs is hindi rin naman e-effect sa kanya. So, hindi na advisable na bigyan pa natin si patient ng mga antiviral drugs like yung oseltamivir or zanamivir. Kasi nga, yung mga drugs na yon kailangan asap mo siyang inumin eh. Within the 24 to 48 hours na nagkaramdam ka ng symptoms or nagkaroon ka ng symptoms, dapat i-take mo na siya. Kasi it prevents yung pagkalat ng mga symptoms or ng infection doon sa katawan mo. So, dahil sa case ni patient, more than 3 days na siya nakakaramdam ng symptoms, 'di ba? Hindi gumana yung oseltamivir sa kanya dahil nga hindi niya yung tinake ng ASAP. Hindi wala dun sa time frame yung pag-inom niya ng gamot kaya hindi gumana sa kanya. So, ang influenza naman is based sa aming research is talagang ang the best na cure dito is talagang magpahinga ka, kumain ka ng mga masustansyang gulay, prutas, and uminom ka ng maraming tubig. And also, medicines can help talaga, like yung analgesic drugs. So, we advise the patient na i-continue na lang yung pag-inom ng ibuprofen para sa sakit ng katawan niya, para sa lagnat niya. And dun sa mga masasakit na lalamunan niya, natural remedies yung gawin ni patient. And, syempre, to get vaccine every year. So, we advise the family na magpaturok sila para ma-prevent na yung ganong sakit at hindi na sila ulit magkaroon. Pero dun sa mga patient na nagkaroon ng influenza, sa case nito ni patient and ni anak, we advise them na after 48 hours na gumaling sila, is huwag muna sila magpa-vaccine. So, siguro mga 1 week after, pwede na sila magpa-vaccine para maging safe na rin yung buong family and to prevent na magkaroon na sila ulit ng sakit. So, ang ating patient-specific variables, number 1 is 34-year-old male patient, which is ito yung tatay, and the 2.5-year-old male na anak niya. So, these are the references that we use for this case. So, that would be all sa aming case presentation. Thank you very much.